clean area setup. I have an NG tube, I have a pH strips, syringe, lubricant, clean pair of gloves, glass of water, and a basin.
Okay, now what we're going to do is we're going to put our bed to proper working height. Make sure our patient is in a high Fowler's position. Okay, now we're going to lower our side rail. And we're going to make sure we wash our hands. And then we're going to put on our gloves. And then after that, we're going to lay this across our patient's chest. And now my assistant is going to make sure that we have the water and that we have a tray ready just in case we have any secretions coming down. And what we're going to do next is take our tube and make sure we measure the length on it. So we're going to measure from the nose to the ear, and then from the ear we're going to measure down to the xyloid process, which is about right there. And then I'm going to take a little bit of tape and make my measurement. And then I'm going to open up my lubricant. Make sure it's all lubricated. And then I would have my patient before this, obviously it's a mannequin, so I would make sure that I would check the patency of the nostrils to figure out which one is the best nostril to use. And then I would start inserting, and as I'm inserting, my assistant will have our patient drink water and make sure that we tell our patient to have their tongue checked, or their chin tucked.
Okay, where's the cup? Where's the water? Drink. Drink.
And if you do need a little resistance, like I just did there, you would pull back a little bit, not all the way out, and then you would try reinserting further.
Drink.
And ideally, with your patient, you would, where I have the tape, you would have that come up to the nose, but as it being a mannequin, you're not going to be able to insert it that far. Okay, so we're going to aspirate to make sure we're at where we need to be, and you would aspirate 30 milliliters. And then once we aspirate, we're going to put it into our cup. And we're going to check the pH. And compare it with our sheet, and we should be in 4. And then we're going to take our aspirant and suck it back up. And we're going to reinsert it into our tube. And then after that, we're going to make pants with our tape, which is, you have a piece of tape and then you have it like that. And we're going to wrap the tape around the tubing. secure. And then once we do that, we are going to secure this to our patient's gown, never the bed. And you want to make sure that they have enough room so where they turn their head. And then we're going to hook up to our suctioning device. And then this is how you insert a nasogastric tube.
Hello, my name is Lena. I'll be your nurse today, and I am here to give you your daily dosage of your Pepcid.
My what?
Your daily dosage of your Pepcid.
Okay.
May I have your name and date of birth, please?
Jennifer, 1986.
Okay, let me just check the order.
What is this?
It's your Pepcid.
What do I do with it?
You'll take it
How?
orally.
Not if I know
Okay.
Okay.
Okay, the reason why I would give the Pepcid is for short-term treatment of active duodenal ulcers and benign gastric ulcers, maintenance therapy of duodenal ulcers after healing or active ulcers, management of gastrophageal reflux disease, also known as GERD, treatment of heartburn, acid indigestion, and sour stomach, management of gastric hypersecretory states, Zollinger-Ellison syndrome. Prevention and treatment of stress-induced upper GI bleeding in critically ill patients.
Okay, the action of Pepcid is healing and prevention of ulcers, decreased symptoms of gastroesophageal reflux, and decreased secretion of gastric acid.
As a nurse, we would assess for epigastric or abdominal pain and frank or occult blood in the stool, emesis, or gastric aspirate.
Side effects are confusion, dizziness, drowsiness, hallucinations and headaches, constipation, diarrhea, and nausea, decreased sperm D count, erectile dysfunction, gynecomastia, anemia, neutropenia, and thrombocytopenia, pain of the IM site, and hypersensitive reactions. Now, the adverse effects are arrhythmias, granulocytosis, aplastic anemia, and that's it.
What we would instruct the patient to do is not to smoke and let them know that it may cause drowsiness, dizziness, and to avoid driving or other activities requiring alertness until a response of the drug is known. Avoid any alcoholic beverages. Increased fluid and fiber intake and exercise may minimize constipation. And to report onset of black tarry stools, fever, sore throat, diarrhea, dizziness, rash, confusion, or hallucinations.
Okay, the desired outcomes of Pepcid would be a decrease in abdominal pain, heartburn, acid indigestion, and sour stomach. Prevention of gastric irritation and bleeding. Healing of duodenal ulcers can be seen by endoscopy. Therapy is continued at least 6 weeks in treatment of ulcers, but not usually longer than 8 weeks, and decreased symptoms of gastroesophageal reflux.
I walk no more.
Okay? Okay. Miss Jennifer, how are you feeling? Is your stomach upset at all?
Oh, I feel great. Can you make me a sandwich?
Sure, I'll call out the dietary and they'll have to prepare something for you, okay?
Oh, great, thanks.
Well, here's your call bell. Alright, if you need anything, just give it a ring and we'll be
And I don't know what to do after that.
Oh my gosh. Boom!
Wait. Okay, what we're gonna do next is we're gonna lower the bedside. Okay, so just pause it and then I'll cut that.
Cut.
Oh my god!
Alright.
Are we recording?
Is it aspirate?
Aspirate girl. Okay, Miss Jennifer, how are you feeling? Are you having any upset stomach, any indigestion, any heartburn at all?
No, I feel fine. I just want to get back on my motorcycle. Can I go?
Cut. Welcome. Cut.